Yes.
Okay, it's very nice to meet you today. I apologize, I am a little late to your appointment. I got stuck in an emergency down the hall. I appreciate your patience.
Sure, no problem.
So we are going to go ahead and dive right in, excuse me. So I spoke with your previous doctor. It looks like you referred to me actually after an allergy panel that was negative. So it looks like we were maybe suspecting that you had a soy reaction, but everything was negative.
Yes, it was.
Okay. Well, that's good news.
Yeah.
Does look like we're kind of not sure what's going on. So the notes that I have are a little bit conflicting. It looks like you are experiencing some tingling, unsure about numbness, but possible abnormalities going on there.
Yes.
Okay, so let me start with some preliminary information, and then I want to get a little bit better of an idea of what exactly happened.
Okay.
So can I have you just confirm your name for me?
Yep, Imani.
Imani, thank you very much. Beautiful name.
Thank you.
20 years old, correct?
Yes.
Okay. All right. So just to start off with, I'm going to ask you a couple of questions about any symptoms that you might be currently experiencing or have experienced since the incident occurred, which at this point was approximately 6 days ago.
Yes.
Okay. Are you currently in any pain relative to the area? So it looks like we're looking at your left hand.
Yes. Just a little bit. Minor. Yeah.
Okay. If you could give me, like, on a scale of 1 to 10, what would you say? 10 being like the most severe pain.
Right. I'd say about 4.
A 4. Okay,
Yeah.
so mild to moderate, but you are experiencing some pain. Is that a constant pain or just like upon manipulation? Maybe if you touch something?
A little bit of both.
A little bit of both. So you are feeling pain even if you're not doing anything with the hand.
Right.
Okay.
Yeah.
And are you left hand dominant?
No, right hand.
You're right-handed.
Yeah.
Okay. That's good. Okay. Any pain radiating into the upper extremity?
No.
No. Okay. So it is very much isolated to the area there.
Yes.
Okay. Next couple questions are just going to ask if you've had any injuries recently.
Okay.
So just essentially ruling out any neurological deficits because of the tingling specifically. Any spinal injuries? Did you hit your spine, hit your back, fall on your back, anything like that?
No.
Okay. Same thing with your head. Any head injuries, blows to the head?
No.
Okay, good. Neck injuries?
No.
No. Any recent falls?
No.
And no changes in your coordination as well? Not noticing that you're more clumsy than normal?
No.
Okay. No fainting spells?
No.
Okay. How about loss of consciousness?
No.
Any abnormal bruising or discoloration that you've noticed? So maybe a bruise that's appeared and you didn't actually hit anything, so you're not sure where it came from?
No, not that I noticed.
No history of anemia?
No.
Very good. So you did say you were having some pain. Any tenderness anywhere that's maybe unrelated? So maybe in your arm, shoulder, chest?
No, not that I noticed.
Any abnormal hot or cold sensations?
No.
And you did say you were experiencing some tingling. Is the tingling constant as well, or does it kind of come and go?
Yeah, it's a little bit constant. It's like not all the way the intense, but
Okay, so the intensity kind of waxes and wanes, but you do feel it throughout.
right.
Okay.
Yeah.
And the tingling, is it kind of, so would you describe it as like a pins and needles sensation or like a static sensation? Some patients describe it as maybe like when your foot falls asleep and it's waking up again and it is like static.
Yeah, I would say that.
Okay, interesting. Any joint stiffness, so specifically around the fingers or wrist, are you noticing any stiffening?
No.
No, good. Okay. How about any muscle spasms?
No.
Any weakness of the extremity? Are you having difficulty maybe like picking things up or lifting?
A little bit.
A little bit?
Yeah.
Okay. So we'll definitely look into that. How about any swelling or edema? Any like abnormal swelling of your fingers? Have you noticed that they look more puffy than usual?
Yeah, no, not that I
No?
noticed.
Okay, good. Very good. Okay. In the fingers specifically, any differences in temperature? Have you noticed that they're abnormally cold? So like any issues with your circulation?
Sure. well, like on the tips of my fingers, a little bit.
A little bit?
Colder, yeah.
Okay. Definitely look into that. See if there's any issues going on with your circulation. Any issues with fatigue or like difficulty staying awake during the day? Any differences there?
No.
Okay. And lastly, are you experiencing any stress that you maybe is new job, end of a relationship, that kind of thing?
Yeah.
Recently? Okay. Okay. So just noting that simply because unfortunately sometimes stress, mental strain can impact our health physically. So that is something that I will just take a note of, but of course we will still rule out any physical symptoms that could be happening there. Okay.
Okay.
Okay, so let's go ahead and move on. So I want to go ahead and have a look, of course, to see if there's anything I'm noticing externally that looks abnormal. So I'll have you just extend your hand for me. So I'm just going to have a look at the dorsal side of the hand and just looking for any obvious abnormalities. So I'm just going to be palpating with my hands. My hands are cold, I apologize.
Nice.
Okay, so I'm not noticing any edema here, which sometimes we tend to see pockets of swelling at the top of the hand, which I'm not noting. Skin texture is very even. I'm not noticing any normal bumps, no bruising. Okay. The tingling sensation, is it on the back of your hand as well, or mainly on the palm?
I would say mainly on the palm. Yeah.
Okay. Any pain here at all?
Not really.
Not really. Okay. Have you noticed any weakening of your fingernails, your natural nails recently? Are they more brittle maybe than usual?
They are, yeah.
A little bit?
Mm-hmm.
Okay. Interesting. So I'm not noticing any swelling of the fingers, which is a good sign. So also having a look at the cuticle, I like to note any signs of discoloration or abnormal dryness or blistering here, because sometimes that can indicate something more topical, like a fungal infection or a dermatitis. Not noting that here at all. Your nail beds do appear very healthy. Obviously you have artificial nails, but from what I can see, there's no outward damage to this area, so that's a very good sign.
Okay.
And I will be testing for temperature variation, but just right off the bat, your hand is warm to the touch. Fingers, very slightly colder. Okay. I could just have you flip your hand over for me. So just gonna look at the wrist. Okay, can you point to where exactly you're feeling the sensation?
Sure. I would say like here.
Okay, and it's all 4 fingers.
Yeah.
Okay. Okay, so immediately on this side, I do notice that the tips of your fingers are rather cold, specifically in the pinky and ring finger here. It does feel colder. Okay, so having a look at the palm, I'm not noticing any palmar erythema, which would be abnormal reddening of the skin, so could indicate something either topical or like inflammatory. I do see a little bit of pinkening here, but that is totally normal, so that's a good sign. Just feeling for anything here. So just gonna have a look at the nails itself. Do you typically wear artificial nails on a regular basis? That's not something new for you?
No.
Okay. So I'm going to have a look at your capillary refill. So essentially I'm just going to occlude blood flow here. So this finger does feel slightly abnormally cold to me. So I'm just going to test to see if we're getting a normal +2 reaction here. And does look okay. Maybe slightly delayed. It is just a little bit cold in here, so I will take that into account. Do you ever notice in your feet that your toes are colder than normal?
Yeah, sometimes.
Okay. And no history of anemia, you said?
Yeah, not that I know of.
Okay, good. Okay. So capillary refill, I would say, is normal, maybe slightly delayed reaction in these last two fingers.
Sure.
So something that we might want to look into a little bit further. So overall texture of the skin does appear normal. I'm not noting any hives, which I typically wouldn't see on the palm, but it's always good to check. Also not noticing any blistering or callus, so skin texture is very smooth, which is a good sign. Hands are well moisturized. So your skin is dry to the touch but feels moisturized in that it's not peeling or overly dry. There's no cracking. Okay. And your pain level right now is about a 4?
Yeah.
Is it worse if I touch the area?
Maybe by like one
Just a
more,
little-
like
a
a
little-
5.
Okay. Okay. So externally, I really am not seeing anything that I would think is concerning. So I'm just going to take a note there. All right, so I'm just going to check your pulses.
Sure.
So just checking for equal blood flow, making sure that there's nothing abnormal here. So bear with me for just a second. Heart rate is very strong. Okay, pulse is even. I'm not noting any palpitations. Also not noting any tachycardia or bradycardia, which means your heart doesn't appear to be beating any faster or slower than it should be, which is a good sign. So just gonna feel the palm of the hand here, see if I can feel the pulse there. Even with the wrist, which is good. And then lastly, here in the fingers, I should not feel anything. If I do, it might indicate that there's kind of an abnormal circulation happening, and I'm not feeling anything there, so that's good. Okay. All right, so I'm just gonna listen with my stethoscope as well.
Sure.
This is very cold. I do apologize. Just want to let you know it is
Okay.
cold metal. Okay. All right, so just relax for me. I'm just gonna have a listen here. That sounds okay. I'm hearing healthy blood flow. It doesn't sound like there are any occlusions. Just gonna listen for any venous abnormalities here. So essentially listening over the veins, auscultating to see if there's any sign of possible occlusion or deviation here, which is not notable. Just listening for any audible differences bilaterally here. So I might be hearing a very slight difference here, which could explain why your fingers are just a little bit colder on this side. Okay. So that's definitely something I want to look into a little bit further. Okay, I'm hearing just a little bit of an abnormality in the blood flow here, so it does sound like there might be a mild occlusion. No previous injuries to your fingers?
No.
All right. So I did notice a couple slight abnormalities there. Okay. So I'm just gonna go ahead and make a quick note here.
Sure.
So your pulses are normal. I'm hearing adequate pulses both in the palm and at the wrist. So arterially, I'm not sure that there are any abnormalities going on there. I would say that I hear maybe a slight, I wouldn't say occlusion because that would indicate that there's a lack of blood flow, but I would say that there maybe is a little bit of a difference specifically in this back portion of your hand here, which is likely the explanation of why these two fingers are just a little bit colder. So
Okay.
I'm not quite sure what's causing that, but we will go ahead and do some further testing. So move on to testing your temperature more thoroughly. So I have a thermometer gun here, and this is just going to allow me to test your temperature in different areas, and it will give me a more accurate reading.
Sure.
So we're going to start, excuse me, I'm just making sure the sound is off.
Sure.
Okay. So we're going to start here. Now typically at the wrist we will see an average reading at about 97.5, which is good. So that's what we're seeing. Here your thumb. Okay, so if you look here, it's 97.2, and then here, 92.3. So we are seeing about a 4 or 5 degree difference from your thumb to your pinky, which is slightly more of a variance than I would typically see. So that does confirm that there is definitely something going on with your circulation. So even as I test from here, so we're about 96, and then as I come over to the pinky, it's 93. So definitely here specifically, you're getting even 92. It does appear to be isolated to like mid finger, which is where you're experiencing the tingling. So I'm wondering if this is maybe an arterial issue where your veins are experiencing some form of deficit here. I know you said you don't have any history of anemia. When is the last time you had your blood taken? Have you had your labs done recently?
No, it's been a while.
It's been a while, okay. When you do have your labs done, do they have any issue getting your blood taken? Like, do they have trouble?
They do, yeah.
They
I have
do.
small veins.
Okay.
Yeah.
Okay. So I'm just going to test on this side as well. So I'm likely going to refer you to have your labs taken. I would like to have a full panel taken so I can see if there's anything going on internally, see if there's any, maybe sometimes these things are as simple as a vitamin deficiency. So that's something that we can look into for sure. So if your potassium is low or your calcium is deficient, that could be, it would have to be very deficient to be causing a tingling sensation, but that's a possibility. Okay. I am feeling a difference here for sure. Would you say that one side is more painful or more prominent than the other, or is it about the same?
It's a little bit more.
A little more
on that
here?
side, yeah.
Okay. So that makes sense as well. Definitely a gradual change in temperature there. Okay. Alright, so that was your circulatory assessment, and I'm going to go ahead and move on to the mobility assessment. So I want to check to see if there's any stiffening of the joints or if you're having any trouble kind of moving your fingers individually. So what I'm going to start with is if I can have you firstly, just allow me to manipulate you. So just kind of relax your muscles as much as you can. I know it's a little bit difficult, but I'm going to be moving your wrist and your fingers around and just kind of try to allow me to do that as much as possible, okay?
Okay.
So I just want to see if I'm noticing any rigidity, especially in the joint. So just checking at the wrist here. Okay, so I'm going to just bend your wrist here as much as I can. Any pain or discomfort there?
No.
Good, okay. Good mobility. And if we go back, any pain or discomfort there?
No.
Good, okay. So I'll have you relax your hand for me. I'm going to just rotate the thumb. It's fairly mobile. I'm not noticing any stiffening here. Any pain upon movement here?
Not really.
No. Okay. Do you ever notice that your fingers tend to pop or crack? Any abnormal sounds sometimes?
They do, yeah.
Both hands or just your left?
Both, yeah.
Both. Okay. Is that something you've always experienced?
Mm-hmm.
Okay. A little bit stiffer here, it seems like. Is it harder for you or more uncomfortable for you to extend these fingers?
Mm-hmm.
Okay. So I do notice just a little bit of stiffening here in comparison to here. So just as far as like the looseness of your joint, this does feel a little bit tight to me. Okay. Okay. So I'm going to have you perform a couple of things for me. So I'm going to hold these fingers down. If I can have you try to raise your index finger as far as you can towards you. Does that hurt at all?
A little.
A little bit?
Mm-hmm.
Okay. So we'll do the same thing with your middle finger. Does it hurt any worse than the index finger? About
No,
the same?
about the same, yeah.
The same. Okay. Same with your ring finger. Does that hurt anymore? I do see a little bit of shaking there.
Yeah, it does. A little more.
And then the pinky. Same thing. Definitely a tremor here. Are you having difficulty with that one?
Mm-hmm. Yeah.
Okay. Okay. All right. So let me just go ahead and take a note there. I'm definitely noticing some abnormality in the 4th and 5th digit. Okay. So I am going to measure that mobility here. So I'm going to repeat the test this time. I'm going to measure the angle at which you're able to flex your finger.
Sure.
So I'd like you to do the same thing with your index. Okay, so we are at a normal flexion there, so we'll do that with your middle finger. Again, very good mobility there. Okay, so let's try the ring finger. So we do notice that there's definitely not quite as much flexibility. It looks like we are closer to 30 degrees there. Okay, and then lastly we'll try the pinky. So I would say that's only about half. We're definitely only at about 20 degrees there. So we're definitely deficient in this area. Is it any easier if you do both of these at the same time?
A little bit.
A little bit.
Mm-hmm.
Okay. Okay, you can go ahead and relax. Okay, so I'm going to test a little bit of strength in each finger to start with. So I'm going to be using my same finger so that it's about equal strength. So I would like you to try to not allow me to push your thumb backwards if possible. Okay. Very good. Okay. So same thing here. Good. Not bad. Definitely a little bit of difficulty there. Okay. And not as much strength there. Okay. If you do your whole hand. Okay. And then if I can have you squeeze my hand, so squeeze hard. Okay. So I'm really only feeling that strength here. So I am concerned for sure about this area here. Okay. Just want to look at the joint here. I'm not noting any swelling here at the wrist, so I don't think that's related. Okay. So I am going to test your reflexes quickly so I can see if maybe that's what we're having an issue with here. So just try to relax your fingers as much as you can, okay?
Okay.
Good. Good. A little bit of rigidity there, but it's not too bad. Okay. So you see how this finger is just a little bit tighter, and then here you've got almost no muscle tone in the pinky, so that's definitely just slightly abnormal. Do you work on the computer frequently?
Yeah, I do every day.
Every day, okay. Okay. When you're on the computer, do you ever notice maybe after a couple hours of typing, did you have like pain in your pinky or like cramping?
Yeah, cramping for sure.
Okay. So I'm wondering if this could be something related to carpal tunnel, which I'm sure you've heard of before. So I have had instances of patients coming in with beginning stages carpal tunnel where they start to experience tingling. It then progresses into numbness and more severe pain in the area where you start to have what's known as peripheral neuropathy, which we will test you for.
Okay.
How long have you worked in a capacity that allows you to?
Yeah, it's been quite a while.
Quite a while.
Like
Okay.
over 4 years.
Oh, okay. Okay. So 5 days a week on the computer can
Yeah.
definitely put strain on your joints, specifically the pinky, because when we're typing, you do tend to kind of extend and flex with the pinky. So
Right.
could be that that's something we're looking at. You're not experiencing this on your other hand?
I'm not, no.
Okay. Oddly enough, carpal tunnel does tend to affect the non-dominant hand, simply because you're using muscles in your non-dominant hand that you're not typically using throughout the rest of the day.
Right.
Whereas the muscle tone in your dominant hand is a little bit stronger. So I do notice that you have some atrophy here. Essentially just means a weakening of the muscle. So
Okay.
that could be what we're looking at here. I will test you for some different neurological abnormalities. I want to make sure that your sensation is intact as well. A lot of the times with tingling, numbness can occur, so I want to make sure that you are able to feel everything appropriately. Any pain here?
Very slightly.
Very slightly. Okay. And can you describe the pain to me? Is it like a sharp pain? Does it feel like a throbbing?
It's like a sharp pain, but like staticky.
Okay. I see. Okay. So if I could have you just look across the room for me.
Sure.
I'm going to stroke the palm of your hand. I'd like you to just allow me to do it, and then I'm just going to see what your reaction level is here. So. Okay, so I did see just some slight movement there. Let's see. I'm going to do the same thing.
Sure.
Okay. Okay. Just going to test something here. So if I can have you lay your hand as flat as you can. to see if there's any abnormal curvature of the palm there in relation to your fingers. It's very, very slight distension here. So I am noticing just a little bit of swelling there, but it's not severe. And this side is okay. Slightly off center there as well, so it definitely is just a little bit swollen. There's definitely a difference here medially, so essentially if I split your hand in half, I am noticing some distension on this outward half. Not as severe here. Okay, so I'm gonna have you bring your wrist up like this if you can. There you go. And then back the other way. Perfect, perfect, okay. So that's actually not bad there. Okay, that's okay. You can go ahead and relax. Perfect. Okay, I'm just gonna take a couple of notes here. So that actually went better than I expected, so that's good. Slightly swollen, but it's not severe. Obviously slightly asymmetrical, given that the one side is a little bit more edematous. Okay. So your circulatory assessment was slightly abnormal, temperature variation noted, mobility. Strength, slightly abnormal. We're going to test that a little bit more. Okay, so I'm going to test the strength of your hand. So we did test your grip strength, which is your ability to grasp things. I want to test the ability of your hand to pick things up, hold weight overall. So we're going to test that a couple different ways. I have a tool here that is fairly heavy. It's a metal. So what I'm going to do is have you place your elbow on the table. Good. And then I'm going to place this in your hand, and I'd like you to try to hold it up if you can. Okay? Is there any difficulty with that?
No.
No. Okay. And then if I shift the weight, just a little bit of difficulty there. Okay. We do lateral. I'm gonna try. So this is just a little heavier.
Sure.
Good. Definitely a little bit of a difference there. Okay. So if you remove your elbow from the table and then just have it to where your hand is kind of levitating. We're gonna repeat the test. Is that any more or less difficult? About the same. About the same, okay. And he looks a little more difficult there.
A little bit.
Okay. Is that painful, the weight of that?
Not really.
Okay. Now if I can have you try to bring your hand up like this. Okay, so we see that your pinky really didn't do any of the work there. So let's try to force it there. Can you do that again? Definitely some difficulty there. Okay. Pain level still about the same?
Mm-hmm.
Okay, you can relax for just a second. So there's definitely some atrophy in your pinky, meaning that the muscle tone has weakened a little bit. So could be from overuse. Could also be that there is some swelling going on at the joint that's causing a little bit of weakness there. So let's test a little bit of your dexterity.
Okay.
So what I'm going to do is hand you this pen.
Sure.
I'd like you to try to remove the cap using just that one hand.
Okay.
So for example, I can remove the cap fairly easily and then put it back in place. So I'd like you to try to do the same.
Sure.
Good. Okay, so not too bad. You did well with that. I'm gonna hand you this thermometer.
Sure.
I'd like you, I'm sorry, I'm gonna set this on the table.
Okay.
I'd like you to pretend it's a telephone and then demonstrate to me how you would then answer the phone.
Okay.
Good. Okay, very good. I'm gonna hand you this object here. I'd like you to attempt to unscrew with just your fingers. So I
Okay.
will hold it for you,
Sure.
and then if you could just unscrew that for me.
Okay.
Good. Okay, very good. And then are you able to put it back? Perfect. Okay, so your dexterity and your 2 fingers there is good. Okay, so I'm gonna do one last test for that. So
Sure.
I'm gonna hand you this pinwheel here. Just to demonstrate, I would like you to, excuse me, there we go. I would like you to try and trace the line. So for example, I am able to trace the line fairly accurately. I'd like to see if you're just able to do the same.
Okay.
Very good. Now if I repeat the test, holding kind of in between my hands here, I can still do it fairly accurately. So I'd like you to attempt to do the same.
Sure.
Okay, so you did fairly well there. Okay, so your dexterity, I would say, is intact. You're not having any difficulty kind of doing your everyday tasks, probably mainly because obviously we have opposable thumbs, so we're using our thumbs and our index finger to carry a lot of the load there. But it's good that you are able to complete those tasks appropriately. Okay, so we are going to move on to the final portion of your examination today, and this is going to be a test for neurological abnormalities. So I will be testing your sensory perception. Have you ever had?
I have it.
No. Okay, so I will be testing different things. It's essentially going to test your ability to feel things for one. So I will test, whether or not you can feel something, and then whether or not you can feel distinct things. So if you feel object A or object B, can you tell the difference between them?
Okay.
Specifically softer sensations or sharper sensations. So obviously pinprick sensation is something we'll be testing, and it's important because it senses your ability to feel dangerous objects. So for example, if you were to come into contact with a cactus, obviously I want to ensure that you can feel that appropriately.
Okay.
As well as testing your perception as far as if things feel the same all over your hand. So we do have some maybe more sensitive areas at the palm of our hand because our sensory receptors are heightened here. But as far as your fingers, you should feel the same equally. So if we are having a loss of sensation or even a like you're feeling things more in these 2 fingers, that could be something that we need to look into further. So we're going to test it a couple different ways. I'm going to start with what I would say is the easiest.
Sure.
So I have, this is just a regular tongue depressor. For this test, I would like you to close your eyes if you're comfortable with that.
Mm-hmm.
And I'm just going to touch it to the surface of your skin. I'd like you to just indicate to me whether or not you feel it, okay?
Mm-hmm.
Okay, so
Yes.
good.
A little bit.
A little bit. Okay.
A little bit. Yes. A little. Yes. 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 A little bit. Not really. A little slightly.
Okay.
Yes. 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 Slightly. 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 Yes.
Okay. So just a couple abnormalities there. I'm going to repeat the same test this time with a cotton swab. So just to give you an example, this is what you should feel. So same thing, just indicate if you feel.
Okay. Yes. A little bit. Yes. Yes. A little. Yes. Yes. A little bit. Yes. A little.
Okay, so this time I am going to alternate just slightly. So you are either going to feel a soft sensation, which is the same as previously, or you'll feel a slightly sharper sensation. So I'd like you to indicate to me whether or not you feel the soft or dull or the sharp sensation.
Okay.
Okay?
Soft. 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 Dull. 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 Sharp. Sharp. Soft.
Good.
Sharp.
Good.
Soft. Dull. Sharp. Soft. 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 Sharp. Sharp.
Okay. So definitely noticed a couple deficiencies there. So I think what I want to do is test. Let's see. Let's try this one here. And for this one, I'd like you to tell me whether or not it feels different. So, so if I touch you here versus here, that should feel the same. Okay. So you can tell me whether or not you feel it, and then if you feel it differently anywhere, just let me know. If it feels more numb or maybe not as much, you just tell me. Okay.
Feel it. Feel a little less.
Okay.
Less. Slightly.
Okay, so barely feel it there.
Yeah. A little bit. I feel it. Feel it.
Good.
Feel it.
Good. All right, so this time I'd like you to tell me when it starts to feel less.
Okay.
So it's obvious there's a little bit of lack of perception.
Mhm.
So I'm gonna just hold your hand for you here. So for example, if I start here and move up, let's say you feel less on your thumb, tell me at what point it starts to feel not as much.
Okay.
Okay. I feel the same?
Yeah. It's good. The same. Right here.
Less here.
Yeah.
Does it stay that way or does it feel even less as we keep going?
Even less.
Even less.
Yeah.
Okay. And here,
Right here.
less here.
Yeah.
Does it get even less?
Even less. Yeah.
Does this one feel the same as this one or does this one feel less than this one?
Pinky is a lot less.
Pinky's less. Okay. So if I move this way, any difference here?
Slightly.
Slightly. Okay. And here?
Slightly less towards the pinky.
Okay. And here?
Same. 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 Same.
The side of your hand here, is that the same?
Mm-hmm.
Same thing here. Does this feel less?
Yeah.
Okay. Starts to feel less about here.
Right. Yeah.
Okay. So I am going to use this tool here to apply pressure. So essentially I'm going to apply pressure just like this. Same thing, I'd like you to tell me when you start to feel it less.
Okay.
So you feel it about normal there?
I do.
Okay.
Normal. Right there.
Right there. Okay. So that's right at about F5. Let me just mark that down. Just make a note. Okay. Even less here and less here.
Yes.
Do you feel this at all?
Not really.
Not really. Okay. And here?
I feel it. Right here.
Right here. Okay. So it's about medial. And it feels even less. Do you feel it here?
A little bit.
A little bit. So more so than here.
Yeah.
Okay. Okay. And is that the same here? And that all feels normal.
It does.
And you can feel it fine here.
Yes.
Okay. And then coming this way, can you tell me when it starts to feel less?
Right about there a little bit.
Right about here.
Yeah.
Okay, so we're definitely medial. Okay, so I'm going to have you relax your hand for me. I'm going to test this very, very sharp sensation. So this is very distinct. Now, it's not going to hurt you at all, but it is very, very sharp. So you should be able to feel that here.
Yeah.
Same thing, I want you to tell me when it feels less, okay?
Right there. Right there. Little right there.
Okay.
Feels about the same there.
The same. Okay.
Right there.
Okay. So we definitely are having like a medial loss here. And on the side here, does it still feel less?
Yeah.
Can you feel this here?
Only slightly.
Here?
A little bit more.
Does this feel sharp or do you just feel something?
Feel something.
Feel something, okay. Okay, you can go ahead and open your eyes.
Sure.
All right, so let me just take a couple of notes here. So there's definitely some sensory loss going on. I would say it's moderate, in that you are able to feel the sharp sensation, but you don't feel that it's sharp. So that's what leans me more towards moderate versus a mild loss.
Sure.
So I am particularly worried about the pinky. Your circulation does seem to be lacking slightly here. It is kind of mitigated over to the ring finger here, and then obviously we're having some loss specifically in that tip of your finger. You were almost not able to feel anything, so that is a little bit concerning. So the last thing I'm going to test is just for bone conduction and vibration sense.
Sure.
So I'm going to produce a vibrating sensation. I want you to tell me not so much if you feel the object touching you, but if you feel like a radiation of vibration sensation, okay? So you can keep your eyes open. Do you feel vibration here?
I do. Yes.
Good.
I do.
Good.
I feel it, but slightly less.
Okay. You do feel the vibrating, just not as much.
Mm-hmm.
Okay. One more time. Same thing?
Same thing.
Okay. Okay. Alright, Imani, so I would say at this point I would like to refer you to an occupational therapist.
Sure.
So occupational therapy will help work on your dexterity as well as give you some pointers and kind of references to equipment that maybe could better accommodate you. So because you are an office worker or someone who works on a computer a lot of the time, unfortunately the motion our hand makes when we're typing is kind of a curved, unnatural motion, and there's not any structure underneath the palm to support the weight of our fingers,
Right.
As well as the movements. So just to give you an example, there are some tools that you can buy to better accommodate that. So obviously this is not the object, but just to give you an example, they do sell items that are made, either something we can have custom made for you or something you can buy off the market that would essentially sit under your hand like this and give you just a little bit more support there in your fingers.
Right.
So that is definitely something that the occupational therapist will go over with you. As far as the physical therapy, I would like them to work with you on maybe regaining some of the muscle loss that is definitely missing in that pinky finger, as well as a very thorough lab panel that I would like to have done, just so we can ensure that there isn't anything going on as far as like vitamin deficiency or anything that could be causing that lack of circulation. So of course it could be something internal, so we just want to go at it from all angles so that we can rule it out. So from my perspective, I would say unfortunately this was a failed examination. The good news is that we do have a better idea of what is going on, and we can kind of go from there. So I would say at this point we can kind of rule out your initial worry, which was the allergic reaction. I think unfortunately it was coincidental. Okay.
Yeah.
So I will go ahead and get those referrals sent out for you. That way we can get you working with our specialists. Sooner the better, I would say.
Yeah.
So I will send those referrals over. The occupational therapist typically likes to communicate electronically. Is that okay with you?
That's fine.
So if you have access to your patient portal, I definitely would log into that, and they should be contacting you about scheduling an appointment.
Sure.
Okay. Okay. In the meantime, obviously you have to work, so if you can, I would try to take breaks in between. If you can, every hour or two, take a 5-minute break, do some stretching. I will send a couple of videos to your portal that will go over some stretching techniques and some strengthening techniques that you can work on prior to your appointment.
Okay. Sounds good.
Okay. Do you have any questions for me?
No.
No? Okay. All right. Well, thank you so much.
Thank you.
Sorry, unfortunately, it was bad news, but I do think that we should be able to get it fixed for you.
Sure. Okay.
Okay?
Thank you.
Okay. Thank you very much.